Greencorn, Learning Strategist at Mount Saint Vincent University in the Office of Student Experience. Welcome to our new approach to the Faculty Info series to make our information more accessible to you. Today I'm joined by Joanne Mills, psychologist and coordinator of counseling services here at the Mount. She's here to talk to us about acute stress and mental illness and how we can support these students on campus. Joanne, thank you for joining me.
Oh, well, thank you for inviting me.
So first off, how big is the issue of mental health disability on university campuses today?
It's huge, and it's growing every year, not just on our campus or across Canada, but all across North America. So our counseling centers are busy, our health office on campus is busy, our student leaders on the residences, our resident assistants, are dealing with more and more mental health issues, and our faculty are also seeing it within the classroom. So some statistics that just came out from the Canadian Mental Health Association tell us in Canada that 75% of all mental health disorders start before the age of 24. So if you think of our student population, generally within the 18 to 24-year-old age group, that's the population that we're talking about. So if they are going to have an incidence of mental health disorder, generally it will happen within their time frame while they're with us. We also know that 1 in 3 students will report being so depressed that they can't function. So that's a lot of students that probably are not going to be able to do proper work on their papers or to be able to concentrate for their exams. We know that students with disability or anxiety or other mental health issues are twice as likely to drop out of school before they graduate. So it does become a retention issue, and we're concerned about those students that start on the path and then aren't able to finish it. And suicides are the second leading cause of death for this age group. Although I will say they're still rare, thankfully, but it is on the rise, and it's second only to motor vehicle accidents. So it is important for students to get help, and the sooner they get help, then the better they do down the road.
Great. So what exactly is mental illness, and how is acute stress different?
Well, many students have emotional distress, and that emotional distress is often a normal reaction to various stressors or things that are going on in their life, such as a breakup of a relationship, maybe there's a death or a loss in their life, or maybe the parents are going through a divorce, some change in their life that's traumatic. And so an acute stress reaction is a normal reaction to what we would expect for someone going through a situation like that. However, in a situation like that, we would expect them to recover, and sometimes they need support and help, and then they recover on their own over time. A mental disorder, as opposed to that, is something that has a more severe in their symptoms, so it affects their life in a more negative way, and it's more on a longer-term basis, so the chronicity is there. It's over a longer period of time. So it's something that persists in their life. Although it is episodic, it can come and go, which is sometimes interesting and confusing for faculty. I mean, some weeks they may be fine, and some weeks they may not be, because that's the nature of a mental illness. It is episodic, but it's persistent, and it's usually in their life for a long time.
Okay. And so how can acute stress and mental illness, how can they manifest in the classroom? So what do they look like?
Faculty will often notice they might start to skip classes and not be present. They may not be putting their hand up or adding into the discussion or as comfortable to talk. Sometimes they sit very near the door, which is very interesting. I know I have clients that have panic disorder, and for them, or they need to have the chair that's right by the exit. So sometimes they may leave suddenly from class. Sometimes they miss their deadlines, and may or may not even be able to write exams at times.
Okay. So how should faculty support students with acute stress versus mental illness?
Well, the acute stress is something that is at the discretion of faculty, and I always encourage students to talk to their faculty, and it's my experience that most faculty are very understanding of these events in people's lives, and can make their own arrangements with the student, Often, as a psychologist, and I work with students, there are often times when I will, on the student's behalf, send an email to the faculty member, and that's just to give an FYI, this young person is going through a very difficult time and may not meet a deadline or something to that effect. And the professor can make that arrangement directly with the student, and I do encourage a student to talk to their professor about that. A mental health disability is something that the student may require accommodations over the entire duration of their degree. And that student should be encouraged to register with disability services on campus, and they can help the student make arrangements for all the accommodations that they may need. And oftentimes students will advocate for themselves, and that's great, and we do want them to do that. But it's still important for them to register with disability services so that down the road we can make sure that they're taken care of.
Great. And so, for students with acute stress, do they require accommodations? Do they need accommodations? And what kind of accommodations could they possibly receive?
They may need accommodations. I guess that all depends on the situation and the reaction to the situation. Certainly, I've had students that are having a very difficult time at a stage in their life, and it's very hard for them to concentrate. It's very hard for them to study. And in those situations, I often, on their behalf, contact the professor, as I said. Students may go directly to the professor themselves and have that discussion. So they may need accommodations, but it's generally not on a full-time permanent basis. It would be for that incident or for that time frame, and it's not something that would need to be carried on throughout the whole year.
Okay, great. And so who should they speak to if they want some more information or support?
We have free counseling services on campus, so that's a great resource for the university. So we always encourage students to seek out that free confidential counseling services. It's in Everestus, and you can find us by calling 457-6567, or you can visit Counseling Services on the website, or just even walk the student down to our office in 218 Everestus. Often faculty can be the bridge between the student and counseling services. So knowing about our service is important for faculty to refer students down to us for the help that they may need. We also provide support at times to faculty. So when faculty have concerns or they're not sure or they have questions, they can phone us as well, and we often will get back to them or we'll be able to take their call right away and help them with any questions they may have.
Excellent. Well, thank you very much for joining me today, Joanne. It was lovely to have you.
Thank you.
Thank you. For more information on counseling services and how to best support your students, visit www.msvu.ca/counseling services.